Hello, everyone. This is Team 5, consisting of Amanda, Alyssa, Sarah, and myself, Nick. We're here presenting our business model pitch regarding nursing scheduler app. And here is our business model canvas. And it's kind of in a lot of detail, so we'll go dive into each section in a little bit more detail, but just kind of the overall landscape of how we see where value propositions are kind of in the middle and customer segments on the right, key partners on the left, and we'll eventually get to revenue streams. And our next slide is the value exchange map, where you see our service, the scheduling app in the middle, customers on the right. And you can see some of the interactions that those customers will have with the scheduling app. And on the left, you'll see some of the partners that we plan to hire with and those interactions as well. So innovative context. From a little bit of a high level to start off with, our product is a app for scheduling shifts with nurses and hospitals. And what we've noticed and have learned so far is that there is a demand for a better way to communicate between both those parties to increase their level of communication and efficiency, spending a lot of time and stress about scheduling. And some examples might be that a hospital may not really have an official scheduling policy. It's kind of led by an individual, and so they may use Excel sheets. And we kind of envision this app being able to differentiate itself by being able to be a better, higher visibility, so all nurses can see this as well as departments. And that higher visibility allows more collaboration between nurses to pick up shifts or change shifts with themselves without having to go through any other kind of text messagings or off app services, as well as any kind of department managers. They're able to adjust schedules and reflect live updates, send out notifications much more effectively than using any kind of different kind of out of third party app. So it's kind of bringing all those aspects kind of into one. The innovation focus here is to is profitability revenue generation. So now that we've identified that gap, is to use this app to also generate some revenue with a second view on sustainability. And that sustainability is to increase, things like loyal customers because they see a better care and better service being provided. And so they have better loyalty to that hospital, as well as build retention. And burnout is among nurses is pretty common, so we think this is one way to help alleviate some of those pain points. As well as moving forward, there's continued push on a legislative agenda for states. There's certain ones like California and Massachusetts who have gone ahead and put in laws requiring a certain amount of nurse to patient ratios. And those ratios need to be maintained by law, and there could be severe repercussions such as fines from the state, or if there was ever some sort of accidents or poor care, poor performance. Because of the not meeting a ratio, it does open up an avenue of lawsuits. So this is one way to prove that you have the right amount of nurses on staff at times, even in events where people call in sick or have vacation, and it's just a better way to make sure that there aren't any of those mistakes and everyone's well aware of the schedule and those kinds of situations. So network solution for building a digital platform for nurses and scheduling shifts. Okay. So target job, scheduling a sufficient number of nurses within a healthcare system to cover nurse shifts to meet patient needs. And that's what this is ultimately about is, patients and providing that care. And we're something that hospitals can use to leverage to provide the best care for their customers and as well as happier employees, a better work environment, which reduces the amount of burnouts or turnover rates. You know, uh, Customer segments, healthcare organizations, hospital administration, nurses, and patients. So healthcare organizations, hospital administration, so struggling with creating shift schedules within departments, difficulty, transparency, and experience high nurse turnover rates and struggle within that budget. So our app is going to kind of bring all those things together, allow more ease and communication with schedules, those notifications, be nurses having a little bit more input with each other and quickly communicating to that with their scheduler, whether that be their supervisor, and among each other. So if one's not feeling well, they can send out a notification or something, and all nurses within that department know pretty quickly that there's a gap in the schedule and they could possibly switch with them. And it'll make things a little bit faster than trying to text each person, set up phone calls, and there's going to be a lot better transparency between all departments as well. Being able to see where the gaps are in each of those departments and being able to collect that data, you'll be able to determine best paths forward and and reduce those nurse turnover rates. Nurses and patients. So we kind of talked about the burnout rate, and having enough nurses is reduces the number of burnout. The states that have passed requirements on nurse to patient ratios have experienced less burnout and higher nurse retention times, as well as better patient satisfaction. I think, for example, I believe like ER nurses, they recommend a ratio of 4 patients to 1 nurse. Most places are a bit higher, but before and after the implementation in California, they noticed a 7% decrease in mortality rates. So I think that works out to be for them about like 4,000 and a little bit higher than maybe 4,100 um, patients that lives were saved because of that. Value proposition. So the new app is going to help make that shifts change in scheduling a little bit easier and transparency. And we're going to it'll increase those and be able to provide a better service to their customers. And benefits are going to be easy management, lower burnout rates, reduce patient waiting time, balance nurse to patient ratio, and help improve patient care. And that's what we're selling the app on. That's what our goals are going to be to improve these things as we go forward. So the ways that this app can make money here is we're going to have some fees, initial sign up fee to use the app to get everything registered. There's going to be levels of customization, and some of those fees get covered in the startup fee, and paid for. A monthly continued subscription going forward, and an in-app advertising. Customer relationships. So we're thinking about patient care satisfaction, nurse job satisfaction, and positive reputation. Each hospital, I grew up with certain hospitals having bad reputations, and even in specific units of which ones had a strong reputation. So it wasn't just hospital by hospital, but by unit. This one had a good surgeon. This one did not. So things like that. And so, because we want our brand to be so significant that the patients are going to the hospitals and asking, "Hey, do you have this schedule app?" I think the care that is provided is improved because of that, and it helps ensure the right patient to nurse ratio. So going into that hospital, I already feel a bit more confident about using their service. Channels. So this is going to be an app, so obviously a mobile application as well as a company web browser. And we're going to rely on social media to kind of help promote and hopefully get some user-generated content online and circulating as well, so people become more aware of it. We want our customers to be aware and wondering if their hospital is using our product or not. Using artificial intelligence and deep machine learning to identify gaps within the schedule and also determine what times a year, times a day, or anticipate, when that hospital might see more patients. And so with better anticipation, you can also better schedule. So we can use those kinds of tools to better provide patients with that kind of care. Um, Key partnerships, partnering with hiring agencies, nurse incentive programs, healthcare organizations, and mobile app providers to make sure that our products are out there and everyone is familiar with our apps, how to use them. So we need to be key with our partners as well and help drive, our product and make sure it gets promoted and in the right hands. Key activities. So, the key activities of our business are going to be crucial to our success. So, we'll be doing a lot of analyzing and planning. We're going to have to hire UX, UI designing and app development and support teams. And that'll have to be a continued effort as we want to improve our user experience over time. And then some of our cost structures. So third-party integration costs, app development, and maintenance plan, as well as our marketing campaign, kind of talking about, making sure everyone is well aware of our product, from not just the hospitals and nurses, but as well as the end user, or end patient there as well. Key resources. So some of our key resources are going to be manpower, funding, executive support, and legalities. App development, schedule monitoring, technology support, and operations teams for manpower. Funding, community financial support, patient insurance, admins, and fundraising. Executive support, proposal approval, funding and budget approval, formulation of policies and processes and procedures, and legalities, business licenses, work authorizations, and legal representation. And that is the end. So let us know, give us some feedback, and let us know how you think we did. Thank you guys for watching, and I hope you enjoyed it.